Minnesota State Nursing Assistant Skill Videos. Unit 9, Elimination. Skill 53, Bedpan. Some residents that are unable to get out of bed may use a bedpan. Females will use the bedpan for both urine and stool. Males will typically use the bedpan for stool only. Supplies for Skill 53, Bedpan, include a bedpan, toilet tissue, gloves, hand wipes, or a washcloth. Critical steps must be completed correctly to pass this skill. Don't forget to complete standard pre-steps upon entering the room. Before placing a bedpan, lower the head of the bed. Raise the bed to a working level. Apply gloves and turn the resident onto their side. Fold the linens to expose only the buttocks. Position a standard bedpan so the wider end of the pan is aligned with the resident's buttocks. Position the fracture pan with the handle toward the foot of the bed. Hold the bedpan in place while turning the resident onto their back. Check placement. Remove gloves and wash your hands. Cover the resident. Raise the head of the bed and lower the bed. Toilet tissue should be within reach of the resident. Position a hand wipe or wet soapy washcloth within reach of the resident. Instruct resident to clean hands with a hand wipe or washcloth when finished. Give resident the call light and ask the resident to signal when finished. Leave the room and return after a few minutes or when signaled. Apply gloves before touching bedpan. Lower the head of the bed. Raise the bed to a working level and turn the resident onto their side away from you by placing one hand on the resident's hip and one hand on the bedpan, or ask the resident to lift their buttocks. Hold the bedpan while the resident is turning or lifting. Clean the perineal area with toilet tissue, wiping from front to back. Remove the bedpan and place near foot of bed where it will not be spilled. Do not place on bedside stand, tray table, or other clean area. Complete the perineal care if necessary. Check skin for reddened areas and massage around the reddened area according to the care plan. Ensure the resident is covered except when placing or removing the bedpan. Remove gloves and wash your hands. Position the resident on their back or side with linens in place and lower the bed. Complete the standard post steps. Ask the resident if there is anything you can do for him or her. Leave the resident in a safe, comfortable position with the bed in a low, locked position and the call light within reach. Open the curtain. Apply gloves and empty contents of bedpan into a toilet or graduate if urine output must be measured. Rinse the bedpan, pour rinse water into toilet. Return bedpan to proper storage or dirty supply area. Remove gloves and wash hands with soap and water.